Good evening. Welcome to another in our series of Whatcom COVID-19 vaccination forums. I'm Erica Lautenbach, the director of the Whatcom County Health Department, and tonight we're joined by our distinguished panelists to talk about the impacts of the COVID-19 pandemic in our community. We have with us tonight Jody Joyce, Chief Executive Officer of Unity Care Northwest, Dr. Cislina Ledbetter, Executive Director for Health and Wellness at Western Washington University, Anya Milton, Executive Director of the Ferndale Chamber of Commerce, and Greg Winter, Executive Director of the Opportunity Council. It has been a long year for all of us, but the pandemic has disproportionately affected many in our community, including those living in poverty, low-income individuals, and people of color. Tonight we'll be talking about the effects of COVID-19 on education and young people, physical and mental health, our business community, and on homelessness and social service provision. As we move toward recovery from the pandemic, it's important to keep these disparate impacts in mind and to address the systemic issues that have become so visible over the past year. But before we turn to that discussion, I'm going to share a few COVID-19 related updates and some data related to our vaccination progress in Whatcom County. So what's happening now? Last week was a busy week. We learned that 12 to 15-year-olds are now eligible for vaccination. Everyone 12 years and older can now get vaccinated with the Pfizer vaccine. We've seen our county's teens really turn out to get vaccinated. And as of May 17th, over a third of 16 and 17-year-olds have received at least one dose of the Pfizer vaccine, which is the only vaccine available to those under 18. And in just 1 week, about 7% of our 12 to 15-year-olds rolled up their sleeves to get their first shot, including my niece Ainsley, who's 13 and had her shot on Monday. In other news, Governor Inslee announced that all counties would enter or remain in Phase 3 of the Roadmap to Recovery Plan. Phase 3 allows for indoor gatherings of up to 10 people outside your household and outdoor gatherings of up to 50 people, along with greater capacity at restaurants, retail stores, and other businesses. And, most excitingly, as of June 30th, all restrictions will be lifted as long as hospital intensive care units across the state maintain adequate capacity. Finally, the CDC came out with new masking guidance for fully vaccinated people. 2 weeks after receiving your final dose, the CDC has determined that it is safe to go without a mask in both indoor and outdoor spaces and end social distancing. I'm sure enjoying my runs these days, not having to wear a mask. However, you'll continue to need to wear a mask in certain settings, like healthcare facilities and schools, and in businesses that require them. Fully vaccinated individuals are also still required to wear a mask on public transportation. It's really exciting to reach this point, and we know that the state is going to be coming out with more guidance shortly to clarify some of the confusion around masking and the CDC versus the state guidance. We're all looking forward to spending more time with our friends and family, and we see that coming sooner and sooner. So how are we doing on vaccination? We're making good progress. Over half of eligible Whatcom County residents have now received at least one shot, and almost 40% of all Whatcom County residents are fully vaccinated. And the difference here is in terms of first dose versus the whole of those who are eligible versus fully vaccinated of the total population, that almost 40% of the full population is really our best indication of overall community immunity. So we are making good progress. At the same time, we're seeing concerning trends in the ongoing spread of COVID-19. The 14-day average case count in Whatcom County nearly doubled between March and early May. Case counts have been especially high among children and teens, young adults, and adults ages 40 to 59. We're also seeing troubling trends in hospitalizations, and there's been a rapid rise in these hospitalizations since the end of last year. The average age of COVID-19 hospitalizations in our region has dropped from 65 years of age in January to 52. We're seeing, though, that vaccination works. It is safe and effective, and this slide is evidence of that. As of May 1st, the 14-day case rate for vaccinated people was only 19 out of every 100,000 Whatcom County residents. Those are those breakthrough cases where someone receives a vaccination and then contracts the virus later on. For unvaccinated people, it was 289 per 100,000. And I think it's really important to just briefly share that among those who are vaccinated, even if they contracted the virus following being vaccinated, not a single one has ended up in our hospital or has died after being vaccinated. So it is effective in preventing severe illness and death in our community, even if someone later contracts the virus. We're also seeing slower rates of vaccination in some parts of the county. So please talk to your friends and family members who haven't yet gotten a vaccine. Encourage them to do so. Stories are important, and your vaccination story is both personal to you and also an opportunity to share the value of being vaccinated. We want everyone to be protected so we can put the COVID-19 pandemic behind us. So, how to get vaccinated? If you haven't yet gotten vaccinated, there's lots of options. Vaccine appointments are available at pharmacies, community vaccination sites, and healthcare provider offices across the county. We have 50 provider sites, which include all of those locations around the county. So there are a lot of ways to connect with vaccine in places where you frequent, feel comfortable, or have a relationship. In addition, we have pop-up clinics that are being held in various parts of the county. Watch the county's COVID vaccine website for a weekly list of vaccination events. Many vaccine providers are also now taking walk-in appointments, including the Community Vaccination Center at BTC. And there's no cost for anyone, regardless of your insurance, health insurance status, or any other status. There is no cost for anyone to be vaccinated. To find a vaccine provider, the best place to start is Vaccine Locator at vaccinelocator.doh.wa.gov. It provides a list of vaccine providers in your area, and it will also tell you which vaccine type the provider offers, if there are appointments available, and when the information was last updated. If you have difficulty navigating the online systems, need language assistance, or just want to talk to someone on the phone and prefer that to looking on the website, you can also call the Washington State COVID-19 hotline at 1-833-VAX-HELP, VAX, HELP. Call takers can help you find an appointment and plan your vaccination. And with that, we'll turn it to our panel discussion, and I'm really looking forward to this conversation. The timing of this discussion is very good, as the Whatcom County Health Department is just now starting to conduct a COVID-19 impact assessment. Over the next several months, we'll be collecting data to tell the story about the effects of COVID-19 in our community. And this is really important because it gives all of us some grounding in what has happened, both from a health perspective, social, emotional, mental health, economic, and other impacts that we may not even know of. And we want to be able to use this as a tool for our community, for our partners and providers to use as they work through how to prioritize some activities. This is also a guide as we receive additional funding from the federal government and consult with our policymakers and elected officials on how we can prioritize our recovery efforts. So this really gives us some grounding in how we can move forward and what recovery might look like and how to maximize our impact on recovery. At the end of our panel discussion, we'll provide more information about how you can help with this effort. We invite and encourage your involvement. Every voice in Whatcom County has a story to share and important information for us to understand as we build this assessment. We're interested in all kinds of information that can help us tell the story about how people and the community resources and institutions we all depend upon have been impacted. If you've collected or know of data about the impacts of COVID on people's lives, please share them with us. It could be surveys, reports, interviews, stories, or videos. We're also interested in any recommendations or plans that are being made to help our community recover. Now I'm going to turn it over to our panelists, and I'm going to start with the first question. That first question I'm going to start with Greg Winter, the Executive Director of the Opportunity Council. Greg, looking back over the last year, what are 2 or 3 things that stand out the most about the effects of COVID-19 pandemic on the people you serve at the Opportunity Council?
Yeah, hi, Erica. Thanks for having us tonight. And you mentioned, I didn't know you were talking about the need for data. And in response to this question, I wanted to tell you about a survey we did recently at the end of last year where we surveyed 600 of our clients, and we asked them a very basic open-ended question: how has COVID-19 affected your household? And 3 important themes emerged from that question and these 600 stories that we received from people. The most frequent theme were employment and money. People talked about being laid off, reduced hours, how hard it is to find work, and they related how tight their budgets are during the pandemic, falling further and further behind on rent and other bills. And second, many people told us about the complications of having their children stay at home and the challenges associated with the lack of childcare. Their children struggling with online formats of school, and children's mental and physical health. And third, social isolation and mental and emotional health are really taking a toll. People are separated from family and friends and lack interpersonal contact. They're not able to rely on support they typically get from extended family and other households and families and loved ones across the border. Many are anxious, afraid, depressed, and extremely lonely. Reading all of these responses that we received in this survey, I'm really struck by just the magnitude of the challenges that our clients struggle to overcome. But I'm also inspired by their resilience and determination to get to the other side of this. I'm happy to share more detailed information with the health department, and I think we're in the process of doing that.
Great. Thank you for that. And, for those who are watching or listening, can you tell us just a little bit about some of the services that the Opportunity Council provides and who your clients are that you surveyed recently?
Yeah, absolutely. I should have done that at the beginning.
I should have asked. I'm sorry.
These are clients that we've been assisting with housing assistance. People who have been experiencing homelessness or at risk of homelessness. There are people who are receiving energy, utility assistance, help with their bills, and people in our early learning programs, Head Start and the state version of Head Start, ECAP.
Great. Thanks for that. It is hard to hear that data and know that there are people behind that information you just provided and how much people are struggling right now. So thank you for sharing that, and thank you for your forthcoming sharing with the health department so we can include that in our impact assessment. I want to move on to Jody Joyce, who's the CEO of Unity Care Northwest. And maybe for starters, since I forgot to ask Greg, could you tell us a little bit about Unity Care and who you serve and what services you provide? And then maybe go into a little bit of detail on what you're hearing from your clients and patients. Jody, I'm having a little trouble hearing you. I'm not sure if you're muted.
Oh, let me try that
There we
again. Is that
go.
better?
Okay, let's try that. Yes, yes, I can hear you now.
Thank you. Unity Care is a community health center that has locations both in downtown Bellingham and in Ferndale. We see about 20,000 patients annually, and we offer medical, dental, behavioral health, and pharmacy services. And, about 20% of our patients are unhoused. And so I think that one of the greatest realizations for us over the past year is that this pandemic has really exposed and increased the disparities that exist for the least resourced and most underserved people in our community. And, some of us have been able to pivot to working remotely and to continuing with jobs that are necessary and that are continuing to keep us busy. But many of our patients actually are essential workers who lost jobs, lost hours, lost health insurance. And we're also anticipating kind of this delayed accumulation of challenges that haven't fully revealed themselves yet. We've had a lot of delayed care over the past year, initially as people were fearful of coming in because they were afraid of getting COVID from somewhere else. And then as we started opening back up, where we had waits for people before they were able to be seen. And now, whether it's diabetic care or dental care or management of high blood pressure, we are helping our patients catch up on some of the care that they were unable to receive during the peak of the pandemic. And I think now we're embracing that, housing has become even more unaffordable, that people who've lost jobs have also lost homes. And so we're anticipating a long tail of this pandemic as we as a community come together to help meet the needs of people who were already underserved before this pandemic arrived. The other thing is that we have more visits for behavioral health than we've ever had. That part of our organization has grown quite significantly over the past year as people have dealt with stress and isolation and depression and other challenges brought on or exposed by this pandemic.
Yeah, we're hearing that from all of our behavioral health providers, that the wait times are longer for an intake, for appointments, and just as our community needs those services the most, we're the most stretched to be able to provide them as a system. So I've definitely been hearing that. And Anya Milton, who's the executive director of the Ferndale Chamber of Commerce, I know you have a lot of perspective about just the economic impacts and the impacts on the businesses, and of course, then in turn, those impacts on the employees within those businesses that we're hearing about so loud and clear from both Greg and Jody.
Right, absolutely. And just to give perspective for our viewers and listeners is that, chambers of commerce are really to be the change makers in the communities, to identify needs and help address them with all the other collaborators in the picture. And so when we talk about the people we serve, we are a membership organization. However, we have the larger picture in view. And so when this pandemic started, all the chamber directors started getting together. We met on weekly Zoom calls and supported each other in trying to figure out how best to serve our members and then also the other businesses that are struggling. So how do we reach out to all of them and be that conduit of information and the support system needed for them to remain viable throughout the pandemic. And one of the things we often talked about is how, as we shut down, we cocooned. We cocooned and became these chrysalises of mushy, mushy goo. And we're trying to figure out how to come back as a beautiful butterfly, in that we are sustainable organizations and businesses that are going to continue to contribute to our community and to the economic development of our region. And so, again, like as a chamber, we look at the larger picture. We look at, when we listen to Greg and to Jody, we hear about what's happening at the, 100-foot view. And we're up a little bit higher looking down, because all of those things that they shared about what their clients are experiencing, all of my members are experiencing that. All of my family members, I've experienced a lot of that too. So there are aspects that we all share, and then there are all these different facets that we need to work together with in order to figure out how we build back stronger. And one of the things that really stands out to me is how we have to be nimble and resilient. We have to change on a dime. Like I heard the word pivot used. Pivot is like the most used word in 2020. And as tiresome as it is to, and cliche as it is to use that word, there's nothing that really, qualifies what is happening. We take one step forward and then we have to do an about face. And that is how it has been for those first several months of this pandemic. So it definitely has affected our businesses and the business community, and trying to figure out how we maintain the support for them and their employees and their health as well.
Yeah, thanks for that, Anya. Yeah, I think the only consistency in the last 15 months has been inconsistency and uncertainty.
Exactly.
It's been hard on all of us. I know it's taken its toll. Thanks for sharing that perspective from your businesses as well. Dr. Ledbetter, thank you for joining us. Really appreciate your time. And I wonder if you could tell us a little bit about your role at Western. It's such a large organization, and what your role is and what you're hearing in terms of students and your faculty as well and staff.
Yeah, so thank you so much, Erica, and I'm excited about this conversation. I'm glad we're talking about this. I am the Executive Director of Counseling, Health, and Wellness at Western Washington University, and so I oversee the Counseling Center, the Prevention and Wellness Services, and the Student Health Center. And so I was on the ground, July of 2019. So I was only there for 6 months before COVID hit. And so I went from having a group of 3 offices that I oversaw to managing COVID operations for our campus. And so that was like 12 additional offices that I was responsible for helping coordinate. And so I think that, like the other panelists, we have not, gone unscathed. No one. I mean, this pandemic has been the great equalizer, and we were already in a mental health pandemic when COVID hit. So it has been really a strain on all segments of our institution, administration, faculty, staff, students. All of us have really struggled with how to manage through this pandemic. I'm going to share just a few data points with you to kind of encapsulate, to share just how pervasive this has been. And so this data comes from September of 2020. So 47% of 18 to 26-year-olds reported that their employment status or income status have been reduced. So not unlike earlier data that we've heard. 48.6% of young adults, 18 to 26, reported often or always feeling stress over finances, compared with 25% of those 27 years and older. And so what it says is that, the idea is our students are working, our students are out there feeling the same thing. They're in homes with parents who are stressed out over stable income. And so, when I think about the how each of these segments have been impacted, particularly on our campus. There were some things that we struggled with for sure, mental health, right? And then the physical health, because I called them the three W's: the washing the hands, the watching the distance, and the wearing the mask. So we had those three W's, and we've been juggling this uncertainty like everyone else, and uncertainty breeds anxiety. And so there's been so much anxiety on our campus. And you mentioned faculty. Faculty have been anxious just as students have been anxious. We're talking about what it means to come back, fall planning. And so I don't want to get ahead of your questions, but we are seeing, just about every thing that I can talk about where we talk about the challenges. I can also talk about some of the benefits, some of the things that we've learned in COVID that have also helped us, particularly in this learning environment. And I also want to talk about the K through 12, and that they've also, we are blurred. We are in this space where we're blurred. We have blurred lines, right? I have a 15-year-old, and so the whole idea that now there's very little separation between what it means to be mom, what it means to be breadwinner, what it means to make sure that my kids are doing their homework, the anxiety of being online, 5, 6, 7, 8 hours a day, and just trying to navigate the stress of what that means. And am I doing too much? Am I staying online too much? Am I making sure that he's doing what he needs to do? And I think that I'm not unique. I think parents are really juggling with what this means. And I heard some experts, because I'm just sort of tracking Gallup, who's been doing the longest well-being survey in the country, and they've been just kind of talking about how parents have been suffering, and the well-being index suggests that all of us are feeling more stress, both our younger folks and the adults in the room. We're all really just navigating what it means to be in this space together, because it's good to be able to spread out some and go and come back, and there's nowhere to go and there's no coming back, and so we're all just kind of navigating what this next phase may be for us all.
Yeah.
So thanks, Erica.
Yeah, thanks for that. And I do want to just give a little shout out. The data that you provided is actually local data from Whatcom County that Dr. Bennett from Western Washington conducted a large scale survey in partnership with the health department. So yeah, so I knew I recognized those data points, but but it's important to note that that's not national data or data from another place. Those are our kids. Those are their experiences that they're having right now. So thank you for sharing that.
That's right. Absolutely.
Yeah, thank you. I want to move on to the next question. We could continue to talk about this so much more, but I do have some other questions. And this is somewhat related, but I want to start with you, Jody, because you referenced this long tail of recovery, right? And I'm curious about, for each of you, in the work that you do, what do you feel like are the lasting impacts of COVID, both negative, which you shared some of those negative impacts, but also some of the positive impacts as we move out of this. We're all, okay, I can just say this, we're all much better at Zoom and GoToMeeting and having remote meetings and not having to drive all day long to meeting. So that's one maybe potentially positive impact, although I know we're all tired of looking at each other in 2D. But what are some other things that you're noting from your organizational perspective?
Yeah, I think that, first of all, to talk about our workforce a bit, we have an amazing team. And, early in the pandemic, the governor closed non-emergent dental services, and almost half of our care was for dental patients. So we ended up with a large part of our workforce that couldn't do their normal jobs. And they pitched right in to start being patient screeners, to start organizing our workplace so that it was environmentally safe, taking on new duties of curbside medication delivery for our patients and delivering medications to our patients' homes. So I think that adaptability, flexibility, resiliency, it's something that has really been nurtured during this time, and it's one of the things we really want to hold on to. We've learned a lot about the value of collaboration and creativity and innovation. I think that we also are realizing that there are things we could have been doing before that we need to keep doing now, that hybrid work arrangements. There are some of our staff that aren't physically interacting with patients all the time, and so I think that some amount of telecommuting and hybrid work arrangements are here to stay. Telehealth has been a huge thing for behavioral health. A lot of our medical patients are not as eager to continue to have virtual visits instead of in-person visits. The telehealth has been really beneficial for our behavioral health patients, and we've grown our behavioral health services. We've added new counselors because it's such a need. Another thing is, just today we started a therapeutic garden up in Ferndale at our clinic to be part of our therapy for our children and the behavioral health patients. And I think that we're realizing that there are many ways to think broadly about what health and what whole person care look like. And I think the last thing that I think what's changed us and that we've had a really clear realization about is that there's been a lot of polarization in the last year. A polarization of the impact of this pandemic, a polarization of beliefs, a polarization of behaviors. And we need to work more cohesively and more collaboratively and align ourselves more effectively to not allow stresses and pressures to pull us apart. And so those are some of the things. The last thing I'll mention is that we launched an IDEA Council this January. It stands for Inclusion, Diversity, Equity, and Anti-Racism. And I think as we saw peel back the veneer of inequity and disparity here, that we realized that while these were things that were important to us, that we weren't organized enough in how we were addressing these issues. And so now we have within our organization an effort that is aimed both at our workforce and at our patients in our community on how to make sure that we're doing everything we can to support inclusion and diversity and equity and justice.
Thank you. COVID revealed a lot of truths about our society, and one of the hardest truths was the existing inequities and the disparities. And I am hopeful that while that work will be part of that long tail, that we will actually make real strides and make changes in meaningful and impactful and long-lasting ways. And I appreciate you sharing about the IDEA Council. I think that work is really necessary and really important. So thank you. I also just want to highlight that collaboration has been, it's been on highlight for the last 15 months, and I want to recognize Unity Care and your organization's involvement with our community vaccination center at Bellingham Technical College. It's been such a great partnership, along with other partners as well, but Unity Care was just incredible in the way that you stepped up and provided staffing and expertise for that effort. So thank you for that.
Thanks, Erica.
Yeah, and Anya, I will also just share, and I'll ask you this question next, but when we talk about collaboration, I still meet with all of our chambers every other week, and we talk about strategies where we can move forward together and make sure that we're keeping both the economic impacts and the health impacts in mind together as we partner moving forward. So Anya, what do you see as the long-lasting impacts for the business community and for the area that you represent as a chamber leader?
Right. Absolutely. Well, I want to dovetail onto what Jody was saying about collaboration, because one of the things that really helped our business community was the streamlining of information in how to handle situations. And so that came from that early on collaboration with the health department and with other business organizations, with the Port of Bellingham, with our whole Whatcom Together group, which worked on the Safer, Stronger Together campaign, of which Dr. Bennett was on as well. There was probably a larger group of like 50 people that were part of that conversation that took place. And what really happened was like the playing field was leveled. And we were, in a sense, forced to listen differently than we have before. And how can we, in the areas and the spheres that we represent, how can we show up to combat what's going on? Because we all play an integral role. So I want to share a situation. A couple weeks ago, we were on this call with Erica, and I was listening to her talk about how the vaccination numbers were significantly lower in the northern part of the county. And as I'm listening to this, I'm frustrated going, oh, this is really going to slow us down from opening back up. And this was actually right before the governor made his announcement to reach 70% and open in on June 30th. So, I'm thinking my wheels are turning. I'm texting people, would you be interested in hosting a pop-up clinic, like local places, because Boundary Bay just had their clinic. What I found from that little spurring conversation that started a larger conversation was that there was a need to host a pop-up clinic in Ferndale. And yesterday we hosted one with the National Guard, and Washington State Department of Health came in collaboration with Lummi Tribal Health and the Laktemish Foundation. And what happened was we pulled our local chamber members and our board members and said, can you help us incentivize vaccines? And they said, absolutely. So they threw funding towards incentivization, and we used that incentivization to help our businesses that are struggling. So people came and got a $5 voucher for a beverage, whether that's a beer or a milkshake, doesn't matter. But it's something that, you can take that money and go and, patronize a business that's been struggling. And hopefully maybe you buy something else. And we're vaccinating people. We had a lot of anxiety about how many people were actually going to show up in Ferndale. And we had a really meager goal of like 100 people. We surpassed that gloriously yesterday and vaccinating 195 people. And that is fascinating to me. A lot of people heard it on the radio and came in. And I want to share a quick story with you about an individual who heard it on the radio, came down, wasn't sure if she wanted to have the vaccine or not, but she was able to talk to several individuals, including the doctor that was on site. And they worked through the questions that she had, and she decided that, yes, this was probably the best bet for me. If I were going to get vaccinated, then the Johnson & Johnson shot would be the one that would work for her. And it took her about an hour to figure that out, that she wanted to do that. And we encourage her, because it takes bravery to do that. It takes courage. If you're scared, there's a lot of hesitators that don't know. And so if people have questions, I just encourage them to seek answers. Come down. And our clinic was so successful that the health department asked us to host another one tomorrow. So lickety split, we are gearing up for another 6-hour clinic tomorrow at the Pioneer Pavilion here in Ferndale. So hopefully we're going to be moving the needle in the right direction, quite literally.
Yes. Anya, this woman is a doer. She is a doer. We really appreciate your partnership. And we Anya and I were talking last week and laughing about, gosh, did you as a chamber leader think 16 months ago you'd be talking about vaccine clinics? Never. But we're doing this together, and it's making a difference, because every shot matters. Every shot counts. Every shot gets us closer to community immunity. So thank you for that. Thanks for your partnership.
Absolutely.
Dr. Ledbetter, I'm really curious about your thoughts on the lasting impacts. I think about my stepson is actually a student at Western, and young people have been impacted differently. And I can't imagine what life would have been like for me when I was at my most social, my most wanting to be around people, my most disconnected from having my one person, my husband, that I do now, that I could be in my bubble. These kids are really impacted in a different way and don't have some of the same tools or resources available to them to be able to sort of work through this anxiety and social distance, right? And what that means. So what are you, and I know your background is as a clinical psychiatrist. So what are you thinking in terms of long-term impacts?
Yeah, thanks, Erica. Actually, that's an amazing question. And my background is a social psychologist. So I am that person who usually digs in the data. And the brilliant folks, like the clinical folks, are the ones who are boots on the ground. But I'll tell you that you really did nail it. There is a growing concern about the isolation, depression, and anxiety. All of them are up. I think we are probably up about 40% in terms of our telehealth. We've got psychiatrists, psychologists, and mental health counselors on board serving students, and our numbers have just increased year over year. And so in terms of lasting impacts, that remains to be seen. I think that when I think about it, I think that there are benefits and some, challenges to all of this. And so when I think about learning, I think our students have become masters of the Zoom screen on one hand. They know how to connect, and the access to education has certainly expanded as we think about students who may not have been able to either get to campus or who otherwise may not have wanted to be on campus, and now they're all in the same room, they're on a Zoom screen. That's the upside. The downside is we know that Zoom burnout is real. We know that there's a recent study by Stanford University that talks about seeing yourself on the screen actually activates the fight or flight response. And so the repeated exposure of seeing yourself on the screen, of having your camera on, or feeling the pressure. A Zoom hour is like 2 hours in an actual classroom. The uncertainty about whether students will be able to come back to campus we've mandated vaccines for faculty, staff, and students. But the anxiety about coming back to campus and whether it's going to be a hybrid model or whether it's going to be all in person or a high flex model, it's really weighing on our students and our community in general. The other thing that I'll talk about is the social piece, the social connection. We're social beings. We're not meant to be in our houses for 14 months straight. And so the whole idea of being, on one hand, you are in the house a lot more and connected with the people that you're connected with. That's one piece. The other thing that folks may not have thought about is being at home isn't always a safe or comfortable place for people. Sometimes being at home can, cause great levels of anxiety. And so that has been borne out in the data where well-being is down, divorce is up, and students and our community are struggling with that, just the way the rest of the segments are. So then there's the mental health piece, right? So we already talked about isolation, depression, and anxiety being up. The good news about that is for years, mental health professionals have tried to talk about and dispel myths around stigma and mental health. I think now even with celebrities coming out and talking about their struggles with mental health, this pandemic has helped us, even though we were in a mental health crisis before COVID hit, has helped us shake some of the stigma around therapy and around getting help, around talking to someone, even if it's not a therapist, finding someone to talk to. I was in my son's school earlier today because he went to get his first shot, my 15-year-old, and I noticed in the high school, there was a sign on the wall that said mental health means talking to someone. And that was amazing. I thought, this is great. We want to normalize the whole idea that you have stress and anxiety and that you have to have something more to have a conversation with someone. And then I would be remiss if I didn't at least say that the third pandemic, so we've got the COVID and we've got the mental health, but then that racial unrest that Jody was kind of alluded to has been really stressful. And so for segments of us, I've got 3 Black boys, and it is stressful, just, the conversations that they have to entertain, and I think constantly about how they are managing this new conversation for so many that they've been having, navigating, sorting through their entire lives. And it sort of feels like it's raw and on display now. And so I think about that in the context of COVID and the mental health challenges that they and the whole world even, right, that we're facing. And so I am hopeful. I am an eternal optimist. I am hopeful. And I believe that the tail will be long. But I do believe that we are beginning to see, as the amazing people at Western and our partners in the community, I believe that we're going to get through this because we are that kind of community that does get through this. We understand what it means to have boots on the ground. We understand what it means to collaborate. And I am encouraging Western to do even more collaborating. We collaborated on our pop-up vaccination clinics with the National Guard, and so that has been pretty fun. I think we've vaccinated over 350 people so far, and so that's been both community members, faculty, staff, and students. And so it's just been wonderful to see folks come together and anticipate the end of this, and I hope that it comes sooner than later. But we're hanging in there doing what we need to do.
Yeah. Thank you. And just to add another, I could talk about collaboration with each and every one of you, but we worked with Western, and you'll probably remember this, Dr. Ledbetter, that we worked with Western and you embedded some of your work study students and interns into our case and contact investigations, who specifically reached out to their peers as a more trusted resource for sharing information and as they had been newly diagnosed, they were much more interested in connecting with someone their age than with all the old people like me. So it was very helpful for us to have that perspective and to have young people involved in the effort. And I'm always a public health evangelizer, so I hope that they'll now explore the field of public health and potentially want to work for the health department. But it was a nice collaboration too, so we thank you for that as well.
Absolutely.
Yeah.
Thank you.
I want to move on to Greg Winter, and when I think about, the many areas that you touch in our community and the population that you serve, I know that population has been really disproportionately impacted by COVID, and I'm sure you see that long tail as well. But could you talk about what you anticipate in terms of long-term impacts too?
Sure. There's so many ways to answer this question, but I'll touch on a couple of areas. We've talked on the panel a little bit about this already, but we've become even more aware of the health and power disparities associated with race and ethnicity, and a lasting impact, I hope, is that we'll all increasingly develop more focused equity lenses in our strategies moving forward. And as an example, one strategy that we expanded or intensified is partnering with organizations and programs that primarily serve people of color, especially in our outreach to tribes and to farm workers, working with Lummi Nation and Nooksack Tribe, with CMAR's Promotores program, with community to community, to help intensify our outreach to populations that may have historically been more at the outer edges of our outreach. And there's a lot more work that we have to do to further those partnerships and optimize them and measure their impacts. So that's, I think, going to be a lasting impact on on how we do, how we deliver services. And, something that I think everybody can identify with is that one of the first change that became necessary for all organizations was that we needed to learn how to be protective of loved ones, family, friends, the people that we serve, while being isolated from them. And at work, that meant becoming more agile in how we deliver services and in how we work internally to support each other. So in the process, we've become even more aware of the challenges people face in their work-life balance. And I think, and I hope that that's going to lead to workplace practices that are more flexible and that ultimately end up being, more supportive of our staff and translating into better services for our clients.
Yeah, such a good point. I think there's so much opportunity to really change the way we work and live and make sure that those things are balanced. We know that it's such a tenuous balance, and being mindful of the health and well-being of staff. Just to share a brief story, most of the health department staff have now been fully vaccinated or on their path to vaccination, and we're starting to slowly come back into our office. And last Monday, I was there for the first time in a bit, and it felt like a family reunion. And we were able to hug each other and see each other in person. And it was really transformative, because I think we often think about the workplace as a place where we go and, all of us are doing work that we believe is really meaningful and impactful, but we don't always identify as it's also a community. And I think that will change for the health department, and hopefully for many other organizations, that we're a community of people who, yes, do work, but also support each other, care for each other, are there for each other, and have each other's backs. So I just, on a positive side, I think that's something I really felt coming back, and just really enjoyed seeing faces in person. So I want to actually go to. Go ahead. I'm sorry.
I was just going to say our workforce, we're at 88% vaccinated, so that day is coming for us soon, I hope.
Yeah, it's exciting. I want to move to our last question. This has been such a good discussion, and I want to talk a little bit about our community as a whole, and really just as leaders engage you in a discussion that sort of moves beyond your individual organizations, but also just your impressions about Whatcom County and your community as you define it. And I'd love to hear your thoughts about what you've learned, both the strengths, the weaknesses, opportunities, resilience. What are ways in which you may be viewing our community differently, more positively or differently than you did before COVID? So I'm going to start with Dr. Ledbetter, and then we'll move from there.
Thank you so much. That is a great question. I am new to this community, not quite 2 years yet. And I think first I want to sort of dovetail what you were talking about in terms of connection. I am hoping that the resonance that shows up when you're in person, the connection that shows up, while I know that impact may be waning as time goes on, I am hoping that people will begin to appreciate connection more, what it means to be connected, to take care of each other, to feel what it means to be in community, beyond a screen. And so I think what this COVID pandemic has taught me about Bellingham and Whatcom County is that we are here for each other, and we will find a way to create the partnerships to get things done. And one of the ways that I've been thinking about being able to bring that to bear and involve Western in the work that we do as a community even more is through a charter called the Okanagan Charter. And the first part of that charter simply says, you are to embed health and promote health promotions in everything that you do. Shift your lens. The second part of it says, and you are to do that with your community. You are a part of the community, its person, place, planet. And as part of that community, you are to envision the work that you do in a sustainable way within the environment that you live. And so, thank you for asking that question. I've really enjoyed making the connections that I've made for sure, and how this community has embraced me just in the short time that I've been here, and being able to work hard and get some things done.
Thank you. I look forward to meeting you in person one of these days, Dr. Ledbetter. Greg, would you like to share a bit? You've been with the Opportunity Council for a while. You're not a newcomer. Any surprises?
Well, I'll be brief because I see our time is short. Not so much surprises, but my observations about the community during the pandemic is that we're good innovators and collaborators. Some great examples of that are, the development of the base camp shelter, for example, in its first iteration with Bellingham School District at the high school, and all that's been done in collaboration around food security. Really some just amazing service delivery there. Also, I'm noticing that, we're impatient. The pandemic seems like it's reinforced the notion that life is short. And, one, I think, example of that, what I mean by that is, homelessness has become even more evident to the public and has energized some people in surprising ways. And our challenge will be to engage with that energy productively with people who want to see change really quickly. So just a couple observations.
Thanks. Jody, any thoughts? And you are just over a year into your role, so lots of learnings, I'm sure, about our community.
Yeah, as I like to say, I've been here 1 month longer than COVID. I got here in late January of 2020. I think, first of all, one of the things I should have mentioned before is we have been overwhelmed by the generosity of this community. One of the things I'm most proud of is we have had no transmissions of COVID on our facilities, even though we've treated hundreds of patients with COVID. And one of the reasons that is true is that Rag Finery here in Bellingham delivered 400 masks to us in late March of last year, which allowed us to go to universal masking for all of our staff and all of our patients. I think that as we think about the future, and what I've learned about our community is that there is incredible generosity, incredible resolve, incredible commitment. And we are better together than we are separately, and that inequities persist, and we shouldn't tolerate those. And Eric, I was struck by an interview you did with the Herald in March, I think, and someone asked you a question about when do you think we'll return to normal? And your answer was, I hope we never return to normal, because normal wasn't doing many of us very well. And I think that's the other thing that I've realized, and that I think that we need to commit to not tolerating the inequities and the challenges that existed before and have been exacerbated by this pandemic. And I know that together that we can solve solutions create solutions that are sustainable and that are effective. And so I'm really looking forward to that.
Yeah, thanks. Anya, 1 minute answer. Can you do it?
Okay. Boil it down. I think the community has learned how to move from transactional interactions to transformative interactions. And that is something that we are learning and listening and trying to apply that equity lens to everything that we do at every level. And truly, we are all here today and talking about how we want to improve the quality of life for the people that we serve and increase our prosperity as a community. And what that means is, to live in richness and fullness with each other. And I think that that is truly, one thing that I think we're going to take away from this entire experience. So that's my 1 minute answer.
Thank you. And I'm sorry to rush you. I do want to pop up that last slide of the PowerPoint that, yes, there we are. So we want to hear from you. We want to hear your stories. We want to know the information that you have. So please support our COVID impact assessment. You can either email Dean White at dwight, WIGHT, at co.whatcom.wa.us, or go to our Bitly site, which is bit.ly/3FWF, capital Z, capital C, capital L. So please do reach out to us. We want to hear from you. We want to hear your stories and your experiences. And with that, I want to thank my panelists. Gosh, it was such a great conversation. Thank you so much. And thank you to all of you who are tuned in and engaged in this work and interested in the work that these leaders are doing. So thank you. Have a great night, everyone. Be well.